Been avoiding the dentist, now is the time to hop back in the chair. Details up next on Comcast Newsmakers.
Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hi, welcome back to Newsmakers, everyone. For some people, nothing is scarier than a trip to the dentist. Here to help quell those fears is this hour's newsmaker, Dr. Lee Weiss, founder of the dental offices of Weiss, Waldy & Associates, and welcome to our show. You're a unique type of dentist, aren't you? You specialize in actually painless, totally painless dentistry.
That's right.
And the painless part is the fact that people aren't really conscious around you.
Exactly right. Mm-hmm.
Why are you kind of unique in what you do?
Well, besides being a dentist, I'm also an anesthesiologist. I did hospital-trained anesthesia for 2 years, and then I was going to be an anesthesiologist, and I decided that I'd rather stay in dentistry. So most of my patients are able to do the same type of anesthesia that you would have in a hospital setting, but in a private practice.
Now, do you find a lot of people have this unbelievable fear of going to the dentist?
It's amazing how many people are panic-stricken at the thought of just seeing a dentist.
And we have some shots of you here in action. And what happens is, what is this fear born out of?
You know, there's so many reasons why people are afraid. They're afraid of the unknown, of needles, of pain, of gagging. It just goes on and on. A psychiatrist can talk for hours about all the reasons why people have these incredible panic attacks about the thought of just seeing a dentist or walking into a dental office.
Now, people, when they come in, they might be panicked. But you're saying, hey, you don't have anything to worry about because you're going to be asleep during the entire procedure. Does that help them cope with their panic and their fear?
Yeah. I mean, most of my patients, they say, if you can put me to sleep, that I'm not aware of what's happening, you can do anything you want. And these people have been avoiding dentistry for many, many, many years. And now they have an opportunity to have it done.
How safe is this anesthesiologist?
Well, all anesthesia has some risk, but the risk is minimal. We take a complete medical history. Every patient is hooked up to EKGs. We have the same monitoring equipment that you would have in the hospital. Our office is actually set up like an OR in the hospital. So we've had absolutely no problems. And
is this the same type of anesthesia that you would take, let's say, if you're having a major operation in the hospital?
It's the same type of anesthesia, but we don't have to give as much because it's not as invasive. The procedures that we do aren't as invasive.
And you find that some people, when they say they're being anesthetized, they get up and they feel groggy. They go, oh, gosh. Is that common, or is it you just kind of like all of a sudden wake up out of a sleep?
Well, I give my patients a choice. Depending on what drug we use, I'll ask you, would you rather be sedated and for the rest of the day, or would you like to just walk out as if nothing had happened? And some patients, they really prefer to be sedated, or some just really would like to be completely awake. So
there's a choice of drugs that actually you'll give people too. Now, this is important because what happens if people just ignore going to the dentist and decide, I'm not going to do this anymore because I just don't want to really face the fear?
Well, there are a number of factors. First of all, the social factors. The fact that the teeth are breaking down, their job, whether they can get a job in a good workplace, there's many social reasons why but more than that, your health is impaired. Cardiovascular reasons, your heart, chances of stroke, diabetes. Not going to the dentist, not taking care of your teeth has many, many health complications. Because
maybe infections might set in there and that affects the rest of your system?
That's one of the reasons. You have chronic infections going through your body every day, and if these aren't removed, the consequences can be very severe.
All right, well, thank you very much. This hour's newsmaker, Dr. Lee Weiss, discussing sleep dentistry. I'm Spiro Canton. Thank you for watching.
The preceding has been a presentation of Comcast Newsmakers. And now, back to CNN Headline News.